Hi, so today I wanted to cover the topic of masking. Now, I briefly mentioned this in one of my other videos that I shared, but masking is something I get questions about a lot, and a lot of people don't understand what it is. So, masking is basically where you're hiding something. You're kind of going, beyond appearances there. So we all mask things. You may be eating somewhere and you are hiding the fact that you absolutely can't stand this food. So you take a bite and it's just gross. And then you're trying to hide your features and trying to hide that response. And you're masking how you feel at that moment. You might do this if someone hurts your feelings. You might mask that you're upset. You might hide that. So we all do that, and with a lot of traits of autism, they're present in society in general, but with autism, like everything else, it's usually a lot more intensive. So with autism and masking, we see this a whole lot in females with autism. We hear about, that's kind of the buzzword with females and autism, is them masking some of their autistic traits. But anyone with autism masks at different times. So I'll give this example. You have a 5-year-old child that struggles with social engagement and they struggle with social anxiety, and then they go to a birthday party. Well, they're excited and they're having a good time at the birthday party, but that's a lot of social pressure. That's a lot of noise. That's a lot of sensory input for them, and it's all at one time. Even though they're having a wonderful time and they're having a blast and it's great and fun, they are having to mask some of that sensory processing overload that they're experiencing. They may have to mask some of their behaviors for covering their ears because it's too loud. They may have to mask their reaction when someone is near them too close and it bothers them. You're in my space kind of situation. But they slowly may be experiencing a heightened sensory overload, a heightened feeling overload. Like, even though it's excitement, that still is a lot of feelings that they're dealing with. And they may be masking everything is okay, everything is perfect, I'm having a wonderful time, and I'm just happy. So everybody on the outside just sees happy little child playing at the birthday party. But parents can see this usually kind of building sometimes, but the child themselves may be able to feel that kind of coming on, and they will try to hide it. They may try to block it out and just kind of deal with it and just make sure, everything looks okay. I'm going to act like it's okay. And then as soon as they get to their safe space, they lose it. They have a full meltdown, whatever you want to call it. They can't handle anymore. They get to a threshold and then they're done. They need to be alone, possibly. They need quiet. They need less people. They may need a special, like I call them loveys, a little, blanket or something soft or a sensory toy to play with. All of these things that help calm them down extrinsically, something from the outside that helps calm them down, and then the things that they use internally to help them calm down. There may be something that they, stimming a lot of times, that kind of crosses the threshold there of internal, external, but there may be things that they need to do to calm back down. Now, they may be able to mask how they're feeling to everybody else at that birthday party for an hour or two, but then at some point it usually comes out if they can't kind of detox, is the phrase I use, kind of detox those feelings and kind of just work through all of that in their own way. So I give the example of a 5-year-old at a birthday party. Think about the social pressures that a teenage girl has when she's going somewhere. And of course, this can even be at school, anywhere like that. And so if they are at school all day around social interaction that makes them nervous or anxious, or they just have to constantly be thinking and using their brain power, focusing on how they're supposed to interact with others to fit in or be normal, so to speak, or so others don't understand that they're struggling with whatever the social pressure is. And it can be beyond social pressure, but I'm just using that as an example with teenage girls. So if they're doing that all day at school, 8 hours of that social pressure, that high intensity that they're dealing with, and they're having to mask how they really feel all the time, that's a lot of mental toll. That's a lot on how you feel. A lot of people with autism struggle with depression, and personally, I just have seen this in talking with them. Sometimes it's because they feel like they have to mask who they are, and if they're constantly pretending to be something else, masking how they feel, how they respond to things, what's important to them, if they're doing that all the time, then they don't feel valued, and they feel like they have to be something they're not. And that's a lot of pressure on them. And then it leads to, it may not be a meltdown in a teenager, it could be, but it may not be. It may be them feeling depressed about who they are. They may withdraw from people altogether. And so there's a lot of this, and I'm not trying to delve off into like the counseling side of this and behavioral side, but there's so many of these pressures that people just don't see And that's at the root of masking. That's what that is they feel the need to hide something, whether that's a response, whether that's, like a stim that they do, or just sometimes it's just who they are. They may not like people. They may not like to talk to people. They may not like things that typical kids their age like, or adults their age do, and things like that. And so they hide all those struggles and bottle them all up. And that's what masking is, and that's why it takes such a big toll on the mental and physical condition of someone with autism.